Sometimes starting down below is the right thing, especially if you feel quite a bit of pressure below. There's glycerin suppositories. There's Biscodil suppositories, which again pull in water. There's little enemas like Fleet enemas. You put that in, you hold it for as long as you can, up to 15 minutes. Those are helpful. Larger volume enemas, I'm hesitant to recommend on a video like this, so talk to your doctor. There are some prescription products that are available, and we'll talk about those in another video. And there's another important category of constipation related to people who need to take narcotics, and we'll talk about that in another video. Thank you very much. Please select like and please subscribe to this channel. We're going to do a lot of good stuff here. Bye. All of these meds need water. Read the instructions carefully. There's no good comparison studies between different kinds of over-the-counter meds that can be helpful. There's no comparison studies about different kinds of over-the-counter meds that can be helpful. Sometimes combining treatments and evaluating yourself as to the best combination is the best. Other categories of drugs include osmotic agents such as osmotic agents such as Go Lightly, osmotic agents such as Go Lightly or Miralax, lactulose, magnesium containing products. Magnesium does not get absorbed by the intestine, so water kind of rushes in and makes everything in the intestine more watery, which could be good for constipation. There's stimulants that are fairly mild. The Biscodil is one of them. Senna is another. These products will be shown along with this video. We ask about drugs, including calcium therapy, drugs that affect the nervous system, whether or not you have bleeding, and specialized testing. So definitely talk to your doctor, especially if you take any of these meds for more than just a few days, or if you have nausea or vomiting. So what are the kinds of therapies that can be helpful? First of all, increasing the amount of bulk in your diet. And that can happen with food or constipation. That can happen with fiber, bulk. People think you should have about 20 to 35 grams of fiber per day from bran or vegetables. There's lots of meds that you can get at your local pharmacy or Amazon. There's bulk forming laxatives that include psyllium. That's milk of magnesia. Please read the instructions on the bottle carefully. The most important thing to remember about that, it takes some time to work, and you need to drink plenty of water. There's also Metamucil. There is polymer. There is polycyclic fiber, known as Fibricon. Polycyclic fiber known as Fibricon. Polycyclic fiber known as Fibricon. There is Benefiber. Doctors ask questions, and the most important thing we do is to rule out obstruction. We don't want to pour medicines into you that can cause lots of pain and discomfort, nausea and vomiting, when the simple cause, not so simple sometimes, is a big blockage. Some drugs can cause this, including narcotics. So it's pretty common, and many patients have this at some point in their lives. I'm not giving you direct medical advice, I'm just educating you, and you might want to talk to your doctor. How do we define constipation? Well, different people define it differently. Some people talk about hard stools, some people talk about less than 3 times per week, straining or incomplete evacuation of their rectum. It's very common, especially in women, people who are over 60, and people who have low physical activity. But this can happen to anyone. So what are the common causes of constipation? Well, a diet lacking in fiber, some neurological diseases that cause neuropathy, such as diabetes, bad things like colon cancer or rectal cancer, and drugs, opiates, and antihistamines, and especially iron therapy. So when you see your doctor or think about, so how is constipation evaluated? Doctors will ask questions, and the most important thing to do is rule out obstruction. Hey, how are you today? Dr. David Chupro here with my first YouTube video. I am a board-certified oncologist, hematologist, and internal medicine. I've been in practice for 30 years, have lots of experience with patients, and I wanted to talk with you about something important. That is a really common problem that patients have, including a friend of mine recently, called constipation. So it's pretty common.